My name's Cortland Robinson, and it is my great pleasure to introduce a good friend and colleague, Dr. Paul Spiegel, who joins us again, having done his previous academic research here as the director of the Center for Refugee and Disaster Response and professor in the Department of International Health. Prior to coming to Hopkins, Dr. Spiegel was Deputy Director of the Division of Program Support and Management at the UN High Commissioner for Refugees, UNHCR, although they call themselves the UN Refugee Agency, just to be a little bit more pronounceable for and understandable to many. And he supervised 4 technical sections: public health, cash-based initiatives, shelter and settlement, and operations solutions and transitions. He's had a number of other roles there, but in the interest of time, I will skip some of those, and perhaps he can touch on some of those in his own remarks. But prior to working with UNHCR, where he was, I think, seconded, he was with Centers for Disease Prevention and Disease Control, where he worked as a medical epidemiologist in the International Emergency and Refugee Health Branch. Also had worked as medical coordinator for Médecins Sans Frontières and Médecins du Monde in Kenya and DRC, and for numerous organizations, including the Canadian Red Cross, where he hails from. There seems to be a Toronto Canadian contingent around the building, with PAHO, Center for Victims of Torture in Toronto, and received his medical degree at the University of Toronto, his MPH here at the Bloomberg School of Public Health, and specialty in preventive medicine, which was across the street, School of Medicine. Or was that here? Oh, that was here, excuse me, my mistake. He has responded himself to a number of humanitarian crises in the field, as well as conducted a variety of research activities published widely in the field on the issues of evidence-based to develop more effective programming in the humanitarian field. His research interests are varied, but include epidemiological methods, health information systems, and HIV. And he'll be speaking to us about the Syrian conflict and its effect on the future of humanitarian action. But I do want to put in a plug for this ongoing humanitarian health seminar series, which Paul will be moderating. The next event is October 20, I believe here in this room, the Humanitarian Development Nexus, November 22nd, What is Needed for Humanitarian Leadership in the Future, and December 8th, Innovative Health Financing in Humanitarian Emergencies. And that's just this year. We'll continue on into 2017 with some additional titles to be added as they evolve. For more information, please contact Ashley Boston with our center at aboston7@jhu.edu, but I'm sure you can find her, and we will be informing you via a variety of messaging, via email and so forth, social media, to make sure you're aware of it and the broader community out there who are interested in these topics. But again, welcome to all of you. Dr. Paul Spiegel.
Good afternoon. I don't know why Court told me I had to wear a striped shirt just like him, but mine didn't have the polo insignia. It's a pleasure to be here, and it's good to see such interest in this topic. So thank you both for those that have come, but also for those in cyberspace. As Court mentioned, this will be the beginning of a series. We have a center here, the Center for Refugee and Disaster Response. That name will actually be changing very soon. So November 26th, can't hear me. Tell me if this works better, yeah? So we have a Center for Refugee and Disaster Response here, and the name will be changing soon, and we hope that all of you will get involved in the center. So today I want to talk about primarily the Syria situation, and because of what's happened, or the Syria disaster, I'd rather say, than situation, and because of what has happened, how it may, and I think likely will, affect future humanitarian response. I think I have this. So as we all know, it's the largest displacement since World War II. There are approximately 65.3 million people displaced, and that's just growing on a daily basis. Of those 21.3 million refugees, when I started at UNHCR 15 years ago, it was so different. The situation was mostly protracted, and there were not that many refugees and significantly more internally displaced persons. But unfortunately, that's changing and changing significantly. But also where the refugees are located, and also how we are responding to them. There's also 10 million stateless people, and I think statelessness is not something that is discussed sufficiently. Sorry. Stateless people, I think the classic is the Rohingya in Myanmar, but stateless, I don't know why that, oh, I know why that's doing, okay. There we go. Stateless people, the Rohingya in Myanmar, for example, are the classic example. And these are people where no country will call them their own. And it's for a variety of reasons. It's an incredible indignity, and they really have no rights wherever they are. And UNHCR has started, we'll see how it goes, but to actually end statelessness, because given that it is approximately 10 million people, it is doable. But I think you'll see a theme throughout this whole discussion is it's politics, and the will of the larger powers to actually make difficult decisions, of which they currently are supremely incapable of doing. So looking around now, we have 54% of the refugees worldwide are actually from 3 countries. And just in 5 years now, Syria has by far become the largest refugee-producing country. Afghanistan and Somalia, it's been decades. But because of this, and because it's a middle-income country, because also it has a huge political significance, it's really changed the way we are seeing things and the way we are responding. You look at the top hosting countries, and that adds up, I put it down to about 7.6 million people. But Turkey here at 2.5 million, again, is astonishing. I don't know who would have thought that Turkey would be having so many refugees. And when you look now, it's only been in the last 5 years. You've got Jordan, Lebanon, Turkey, and also we could add Iraq there and Egypt. The number of refugees have gone up significantly. The standbys, the people that for the longest time have been hosting refugees really have been Iran and Pakistan. They've been number 1 and number 2 for decades, and those are Afghan refugees. Again, a situation that's been going on for a long period of time. The other classic are Ethiopia, Kenya, that doesn't even make now the top, I think it's 5, top 6 countries. And so that's the sub-Saharan Africa. But Syria seems both to be drowning out those situations and actually having possibly a negative effect because of the political attention of Syria and the forgotten aspects of many of the situations in the sub-Saharan Africa, like Central African Republic, like Burundi. And what's even more interesting, actually, being now in North America after not being here for a long period of time, is the lack of interest in the Francophone Africa, where I have to search to try to get information. But being in Europe and in UNHCR, most people are bilingual in French and English, or many are, and the situations in Francophone Africa get much, much more attention. And again, that's just pure political interest. So I want to, before just a bit of background, to say what is traditional, what is actually, what is the basis for our response now, almost pre-Syria. And I put in the norm was, and still is, because even though we are making changes and how we are responding, these still are very important. And the standards that we have now will exist. And one of the concerns that I think many of us have is that we will be making major changes in the humanitarian response system due to Syria, which is a unique situation and also is unparalleled in terms of the amount of money that exists for Syria compared to the other areas. So we're already seeing changes where if it becomes standardized, and this is the way we're going to move forward, will likely be not applicable in many of the smaller emergencies, and particularly those emergencies with not very much money. So if we look around, you've seen this, but this is the Biafran crisis. That's where Doctors Without Borders, Médecins Sans Frontières started in this crisis. These two, unfortunately, are still with us, and this one, thank goodness, is the Cambodia is mostly over. But a lot of how we respond, low income, refugee camps, which is the next one, but low income and poorer countries. So refugee camps is the other. Much of what we, and it is primarily was at the time refugee, but often we can use refugees in the same situation for internally displaced persons. But if we look, we have refugee camps, and I deliberately put Zatri because, as many of you know, Zatri in Jordan is one of the biggest camps around. So refugee camps are not a thing of the past. I wish they were, but they're not. But you also have some of the old classic camps. Dadaab has been around since 1991, second or third largest city in Kenya now. This is also one of, now if you count this as a city, it's the third in Jordan. Doloado in Ethiopia and the Afghan camps. In Pakistan, these were a long time ago. Now most of the Pakistanis in Afghanistan are actually settled, and they're more village-like. But the point is, much of how we respond were camps, which meant often isolated in areas where there wasn't much arable land, land that is productive for growing things. You often had parallel systems, so you had the international community coming in, setting up systems, and then responding appropriately. Thirdly, you had a denominator, and for those of us in public health, it's much easier to respond here when you really know who your population is, how many there are, so you can come up with mortality rates, you can come up with access to services, because there are limited amount of services, generally free. Everything is changing now when you look at out-of-camp situations, of which we'll discuss more. Then the other classic way we responded in the past is with weak governments and few strong national non-governmental organizations or NGOs. And what that meant in the past is that the UN and the strong international NGOs would come in, they would respond, and you could do what you want. You're almost a law unto yourself. So you didn't have to worry about the protocols of whether it be disease protocols, you would use international protocols. Most of these situations, as I said, are in very remote areas, and therefore there's very little government services and government control in the past. We're now seeing a huge change. When there was East Timor, the Indonesian government was a very strong government. Turkey, Jordan, very strong governments. Even Kenya and Ethiopia that years ago were not, or let's say they didn't respond in the same way to refugee settings, now they're responding. And it does mean that the UN and the international NGOs have to change. It means likely less power, likely less money, and how that will play out will be interesting to see, because I think our experience across the board always is organizations and people don't give up power easily and don't give up influence and money easily. And so we have to watch that closely. But it will mean different roles and and I'll go over the funding in shortly, but you'll see astonishingly how much money goes to the UN and international NGOs and not to the local NGOs. Finally, communicable diseases. Most of our responses really are based on communicable diseases, and they still should be. Communicable diseases are incredibly important. But more and more, specifically as we're dealing with middle-income countries, we're dealing with a lot of non-communicable diseases. We're dealing with a healthcare system whose quality is significantly higher, and it's also more costly. And I'll just mention some, because when I was at UNHCR, firstly with the Iraqi refugee setting, we had to deal with issues that we've never really dealt with. You had people coming over with chemotherapy, needed renal dialysis, coronary artery bypass. We didn't really deal with this as much in the sub-Saharan Africa. Not that it didn't exist, of course it did, but this comes up with some of the ethical issues of what level of care do you give, and should one be giving equal care across the globe? I don't think it's actually appropriate, and it's certainly not financially possible. But if we can't do that, what do we do? So we had to set up what were called exceptional care committees, and we had to make priorities to say, first we will prioritize primary health care, emergency obstetrical care, then we will move on to secondary and tertiary care. But that was very, very difficult, and the other issue is that you have a lot of changes in funding cycles, and so you start paying for renal dialysis, and once you do, you're going to be paying for a long period of time. And so how to make these decisions for the NCDs, the non-communicable diseases, and the very expensive tertiary care didn't exist in all of these areas, and donors also are not willing to give as much money to them. So this is another example of how working in a middle-income country with higher healthcare standards and more costly situations actually has affected how we respond. So looking at some of the money, and interestingly, I presented something similar in London recently, and someone said, if you look closely, those numbers don't add up, which is true. So, so if you look here, I'll just read this, the top 7. Firstly, if you look at who it is, it's very interesting because 5 years ago you would never have seen Turkey as number 2, and you would never have seen the United Arab Emirates. Now, Turkey admittedly is not where many of the Western countries are giving globally. Turkey is giving, providing, this is all really within Turkey to the Syrian refugees, but still they're providing a tremendous amount of humanitarian aid to refugees in their own countries. I don't want to say problem, the issue is it's new. So Turkey, some of the standards that they're giving in their camps are not the equivalent that we can give in, as we meaning the UN or international community, outside of Turkey. The UAE as well is requiring and giving a lot of money to certain places. But again, the standards are slightly different. And so as we expand and the number of partners expand, we need to figure out standards and complementarity, or we may have movement from different places. And we also have big issues in terms of accounting and in transparency. Then you look here, and South Sudan and Palestine are the two that have been around for a long period of time, but all of these now, the biggest is Syria, followed by South Sudan, but then Iraq, and then Jordan. Again, it's mostly Syria, and it didn't exist previously. And so actually, sorry, the numbers, this is 18.2 billion. The recipients here for the top 5 are 6 billion. So not that we're missing 12 billion, it just means that there are hundreds and hundreds of other situations where these monies are going to, but not in the same magnitude as here. Looking at the trends though, you can see a significant increase, which is a positive thing, obviously. So you've got in 2015, $28 billion. And if you look between 2012 and 2015, there's a $10 billion increase, which is incredible. Unfortunately, the need this is not keeping up with the pace of the need. And so in 2015, the UN coordinated appeals, which are not so evidence-based. They're very it's a lot of advocacy, it's a lot of they need to be improved, so we can't exactly say these are really the true needs, but still they're an indication, and it's the largest shortfall to date out from all of these years. 45% in 2015 was what was provided. Not enough. Also, when you look, and this is another issue that we'll see throughout the day, or this talk, Iraq was 74% funded, Gambia was 5% funded. And I just looked today because, as you know, there's Monday and Tuesday at the UN General Assembly, there was the first ever refugee migrant summit. And then President Obama had another meeting on Tuesday where there was a pay-to-play where he really requested governments to come in to improve, make agreements to either resettle more refugees, to provide more education to refugees, and to provide overall funding. So in 2016, so we're not done yet, of course, but the UN appeal for the Syrian refugees in the surrounding countries is only 49% funded. South Sudan, which is an incredible mess and just, I know, gets some attention, but not enough. I mean, it's horrific what's happening there, is 19% funded. And Yemen, another really, really horrible situation, is only 22% funded. So whether or not the numbers are exact, it's not, really the real numbers for need, it's less important. We can follow the trends, and we clearly see that although the funding is going up, it is not proportionate to the needs. And again, to emphasize, the numbers are so high now, the needs, because of the numbers of people, the prolongation, the protracted situation, but you're paying a heck of a lot more in middle-income countries than you are in Chad and Sub-Saharan Africa. And all of that really has a difficult effect. So some of the trends, prolonged crises. So as we say, and not just in terms of displacement, but in terms of conflict. So and this is an excellent report if you want to read something, Time to Let Go by ODI in the UK. It's really looking at how the humanitarian system has to change. So one of the big issues, and this is where I got this information from, conflict has increased, has become more protracted. 90% of countries with humanitarian crisis had a humanitarian appeal for over 3 years. One only does humanitarian appeals if there is a crisis. If 90% are over 3 years, it's a problem because we're not having a resolution. Numbers for refugees are variable. Some say 11, some say 17, because it depends on the definition of protracted. Regardless, on average, a refugee is a refugee for over 10 years. And probably in some situations, a couple generations. And that has a major impact when you are planning services. So this is what I was mentioning about the UN and the largest INGOs. So 81% of humanitarian assistance goes to the UN and goes to the international NGOs. 0.2% only go directly to national NGOs. That number, as with all numbers, have to be careful about, because many national NGOs will get money that are funneled through the top here, through the 81%. So of course they get more. But there was a recent meeting, as you know, in UN, we like meetings. And so there was another meeting recently. It was the first World Humanitarian Summit in Istanbul. And there was something called the Grand Bargain, where all the big donors and agencies made certain pledges that are, of course, not enforceable, but they made these pledges. And one of them is to significantly increase funding to national NGOs and increase their capacity. In the past, that may not have been possible, but now there are many, many national NGOs that are strong, that are competent, and that know the cultures and speak the languages. So it makes a lot of sense. But again, it will be quite interesting from a political point of view to see how that will play out. There's also an increasing and new and complex mix of actors, and I've mentioned already from the Middle East, but also you've got, and this one I'm quite excited about, but the private sector is really getting significantly more involved now. And not just in the past, the private sector was involved primarily in logistics or food or blankets, that sort of thing. But now we're actually getting the banking industry, the mobile phone industries, MasterCard, Visa, because there's a whole shift, which I'll talk about shortly, towards cash-based transfers, whether they be vouchers, conditional cash, or unconditional cash. And again, how that's going to have a major, I think a positive, but still a major disruption in humanitarian aid. So how to work, and then finally, actually, and this was big in Jordan and Lebanon, you have a lot of Islamic agencies now receiving a lot of money from the Gulf countries, which can be a good thing, but they don't necessarily have a tradition of response. There is definitely not the same issues of accountability, and because of very complex government rules, we're not always able to, whether it be the UN, those that are working with Hezbollah or others, we're not able to actually coordinate with them at times. So all of this is really causing, let's say, a lack of complementarity and duplication, and that is affecting the efficiency of aid. So now the Syrian crisis. I want to just show you 4 iconic pictures to show our absolute failure, both all of us, I would say, at a personal level. And I remember when I was preparing for this, it was just just horrible. And I remember preparing and just feeling disgusted about the situation, but impotent, but also guilt of how this is still going on after 5 years, and we can't seem to be able to do anything. This is in Damascus. It's a Palestinian refugee camp / city that's been destroyed, and these are people waiting for food. This one, and many of you, and I've spoken with, and I was in Greece as well, and to see what's happening. And again, it's just reality, realpolitik, but Europe started to respond much more seriously in Syria when all of the migration came over. And they didn't respond because we need to help people, but because they wanted to make sure that these people wouldn't be coming over. And it was very, very interesting to see the hypocrisy of the Europeans, but it would be any country, frankly, how it's so easy for ECHO and DFID and the European Union to tell Africa and Asia, you have to respect human rights, you have to treat these refugees humanely, etc. But when it comes on their soil, things change. So, buying off Turkey, giving them $6 billion, putting refugees or asylum seekers at this point, because they haven't been declared refugees, in detention centers in conditions that are as bad as I've seen in many parts of Africa. This one was horrific, as you're quite aware. And then this was a more recent one, but this one can give you nightmares. So what is different about Syria? There's many things that are similar, I must say, but the magnitude, intensity, and prolonged time frame is quite incredible. I mean, you wake up every day. So today we woke up to another healthcare workers that were killed just again, and you see such brutality that exists in many wars, but not necessarily for as long, and not for a long period of time. The antagonism between Russia and the US and Iran and Saudi Arabia, Shia Sunni, that really make this complex. The multiplicity of actors we've discussed, but it's also the multiplicity on the ground, those that are actually fighting, but also getting worse and worse, the impotence of the Security Council, and you see already the inaction from the big players. Middle-income countries, so we discussed that. In fact, some of the first times that we started to deal with middle-income countries really was a couple decades ago with the Balkans situation in Kosovo. That's also where, at the time, we as the humanitarians were forced to deal with middle-income, functioning healthcare systems that were more complex and more costly. But it again is the Iraqi and then the Syria situation that really caused us to say we need better systems in place, and we need to deal with this better. The issues, and I'll speak shortly on the development aspect, but UNHCR came out with an urban policy only about 5 years ago, and most of the time, so who decides to have a refugee camp? It's the government, it's the host government that decides, and most of the time they decide for security reasons. Security reasons, and at times it may be easier to actually deliver aid. But now UNHCR, and I would say the NGOs, everyone is pushing for out-of-camp settings, which is more humane for the refugees, is, if we do it well, will hopefully be positive to the local economy, and also should reduce or should allow for sustainability, because right now we have parallel services in these camps. No one wants to take them over. They just become long-term holding cities, however you wish to call it. So we're moving more towards non-camp, but it does add a lot of complexity, as we can see in Lebanon. The cost of the response, we've discussed, and cash transfers, newer modalities of delivering, and I'll get to that shortly. And the last one are the political implications that are just exacerbated to basically a Cold War level now that didn't exist, unfortunately, in the past. But we're back to that situation, which does mean that we can keep on doing what we're doing, but until there's a political resolution, nothing is going to get better. So I have five, looking at the time, five recommendations. and I'll go through each of these. They seem relatively banal, but when you go into some of the details, some of them are quite far-reaching. The issue of protection and centrality of protection. I just want to get, so I want to read, it's a protection, and UNHCR is a protection agency, yet it is extremely difficult to actually not necessarily define protection. I'll read it to you now. The hard part is to operationalize it. So a definition of protection, the one that UNHCR uses, are all activities aimed at obtaining full respect for the rights of individuals in accordance with international law. They name many of the international laws, taking into account age, gender, social, ethnic, national, religious, or other backgrounds. It reads nice, it kind of makes sense, but how do you actually translate that into activities on the ground? And I think that's been one of the problems that protection agencies have been dealing with for a long time. So one aspect, the way UNHCR and some of the big NGOs are responding is community-based protection. Is yes, you need lawyers to be able to look at some of these clauses and to actually develop these resolutions. It's hugely important, but that's not enough. You have to do the next step and actually be on the ground. And trying to make the idea of protection or the centrality of it understandable and not be something that is more theoretical. And so we're putting people that are not necessarily lawyers but are just strong field, have a lot of field experience. They go into the field and they are trying to help the other, both protection but also the other sectors to implement protection. So as a simple example, recently, and this is a bad example, unfortunately, but in Tanzania and Burundi, there was a huge influx into Tanzania about a year ago, a big cholera outbreak. There were limitations. There was a lot of people, and it was hard to get access to. So decisions have to be made and prioritizations. But for example, the latrines didn't have locks inside the latrines for people. Very, very simple, but it wasn't done. So that's just a simple way of, or insufficient lighting in certain areas that are dark in the camps or the settlement, or sufficient lighting for latrines in those areas. Things that should be basic are still not always occurring. And that's a way that we can mainstream protection, but we need to be looking at it in a much more operational focus. This is an example, this is a picture of an MSF hospital that was bombed in Syria. Another area now that's just become horrific and was unthinkable many years ago. Over the last 2 decades, it's true, in the past the Red Cross, the Red Crescent was a symbol of protection. Now over the years it has become a target, but I don't think, to my knowledge, I have not seen the amount of destruction occurring, deliberate destruction of hospitals, of healthcare workers, as what's going on in Syria and in Yemen. And it's deliberate, it's not it's meant to demoralize the populations. And it's Len Rubenstein, who can't be here today, but he's at Hopkins now, and he's leading an effort to try to deal with this. And on May 3rd, there was a UN Security Council resolution on strengthening the protection for the health workers and and the hospitals, the health services. But again, it's a resolution that really has no teeth. So it's nice. I mean, it's not superficial to have these sort of resolutions. It's very important, but it's not useful unless there can be a way of backing it up. And many of these big resolutions, the only way to back it up is to have political consensus, and we don't have political consensus at the highest levels. And therefore, you see still now Syria and likely Russia bombing various hospitals and aid convoys. One last thing on the concept of the centrality of protection, and that has to do with, we've seen this with HIV and we've seen this with recently in Ebola, is really trying to address restrictions of movement and mandatory testing. Generally, they don't work. And so there are still many countries, some in the Middle East, who have mandatory testing for HIV just for refugees, and well, I shouldn't say just, also for economic migrants. And if they are found positive, at least on the books, they don't actually always put it into practice. There is refoulement or putting people back to where they came from. So that clearly doesn't work. And I remember, actually, Egypt just repealed that law. But when I was working in Egypt 4 or 5 years back visiting, we actually could not test antenatal care. We couldn't test for HIV because they were required by law to, if they did test and they tested for HIV, required to report it. So it has these bizarre repercussions when you actually have these sort of laws, and so we really need to look at that. Similarly, restriction of travel just doesn't work from a public health point of view, yet it's still occurring, and as we've seen in the current political climate, it may even be getting worse now. The next part is really looking at what's called now the Humanitarian Development Nexus. In the past, it was called the Humanitarian Development Gap, the Humanitarian Development Divide. We're calling it Nexus now because we want to get away from this idea of linear. Really what needs to happen is development needs to be, so in the past, if there was a disaster, a conflict, the development people would step aside, the humanitarians would go in, and then when things were normalized or getting normal, then the development folks would come back in. We want to avoid that. The concept is not new, but the opportunities are new, probably because of Syria and particularly because of Lebanon, when you have 1 in 3 or 1 in 4, depending on the numbers, 1 in 4 people or 1 in 3 people in Lebanon are actually refugees. And when that's the case, you can't just think about helping refugees. The whole developmental system of Lebanon is at peril. So what we meaning HCR was working, and eventually I'll stop saying we, but for the moment I'm still saying we. It's too new. I started July 1st. So. UNHCR is working very closely with the World Bank, and Jim Kim has really stepped up here. He's allowed loans actually for middle-income countries, such as in Lebanon and Jordan, that generally the bank will not do, concessional loans, so it's at a very low interest rate. Generally, that's not the case. It's only for low-income countries. And his group, the bank, is working with UNHCR to try to look at the positive and negative effects of refugees on the economies, and we're local national economies. And we're finding really, really interesting results. So for example, in Turkey, 30% of new businesses in 2015 were actually Syrians and not Turks. We're looking at how, not at the national level, but more at the district level, how when you have an influx of refugees, the positive and the negative, and it varies, of course. Fewer refugees may have less of an impact. A lot of refugees means a lot of initial money, people coming in, donors coming in with a lot of money. You see that the businesses actually prosper in many settings, and we've all seen this in Kakuma in Kenya or in Dadaab. They actually, the cities that were very small at the beginning become much bigger with Kenyans. Those that are entrepreneurial can make a lot of money. So it's nuanced. The workers that are less well educated, that are doing factory jobs or just doing agriculture or selling, they may suffer a bit because the refugees will do, if they're allowed to work, or even if they aren't, they go underground anyways, they will do it for a lower price. So it's a more nuanced approach, and what we're trying to do is to actually look at the skills of refugees. For example, there are 15,000 Syrian doctors now. I was speaking with someone from the Physicians for Human Rights. 15,000 Syrian doctors outside of Syria. Most of them can't work. Most of them are in Jordan or Lebanon or Turkey, yet the governments won't allow them to work. You know, if we had Syrian doctors here in the States just from Syria, the States wouldn't allow them to work. They have to be accredited. On the other hand, there are millions of people, Syrians, in those countries, so where those doctors are. So maybe there's a way we can work and try to deal with that. Similarly with teachers, so we're trying to look with the bank and the governments to have a win-win situation in terms of development. The EU deal of the 3 billion, likely 6 billion to Turkey, part of it was Turkey had to agree to allow a certain amount of refugees to actually have livelihoods. Because if we want refugees or internally displaced persons, if you want to stop this dependence and parallel systems, and if you want to integrate them into local systems, which really is our goal, there needs to be a way for them to be able to pay for that. But again, we go back to the politics. So when you have in Jordan 50% unemployment of youths, it's very difficult politically, even if you have a strong economic case, to really allow them to work. And this is where donors and multilateral agencies are trying to work on economic zones in Jordan where there will be a significant increase in the national population's employment as well as refugees and or IDPs. Now, this one won't make me too many friends with my old colleagues in the UN, but currently we do have a crisis in coordination in humanitarian agencies. There's something called the cluster system, which is probably the main system for coordination in non-refugee settings. And then within UNHCR, there's something called the refugee coordination model. The idea was to actually to be able to have continuity and predictability of response. So originally, in fact, when it started, health wasn't included because it was felt, probably wrongly, that WHO or others could deal with health. So it was really those areas where there was a lack of predictability. And it started with, I believe it was 10 clusters, and now there, I think, are 11 or 12. And what happens is, then you have different agencies, primarily UN agencies, but not all, who are leading those clusters. And what happens is you have an emergency. All of these agencies, together with the NGOs, come in. All of them want money. They want to be able to respond. Admittedly, there are huge needs, but there is a lack of prioritization, and it's causing a lot of problems. Plus, there is not really a way at this point to say who can come and who cannot come in terms of international NGOs. So in Haiti, we had horrific experiences of many American NGOs coming, or not even NGOs, mom and pop organizations that suddenly left, who had no clue what they were doing, didn't really understand the system, and actually caused, I would say, more problems with coordination. So one of the ways I would suggest that we deal with this is to actually have fewer UN agencies, as opposed to all of them now. When you look from, not all, most have, and many are not operational. So if we look and we have UNICEF, the World Food Program, and UNHCR are the most operational by a long shot of all these agencies. Could there be a way to actually work with those agencies to have a limited but a stronger response, and say to the other agencies, we'll see, but let's work with those three. Similarly, for international NGOs, there are a lot of international NGOs with varying degrees of competency, but when there is a massive emergency, they'll all come in. There needs to be a way that we can triage those, depending on who's already on the ground. But what happens is it comes in, and then when these decisions are made of who gets what, it's not really based always on who is the best, who is the most appropriate, who is the most effective. And I've been in so many of these meetings, it's much more of a discussion at the UN country team with the resident or the humanitarian coordinator, and it's very hard to say no to certain NGOs and UN agencies, and or they call their head of their UN or NGO, and then they call UNDP or whoever, or UN OCHA. So there's a lot of horse trading going on, and it's incredibly inefficient. So one would be to have fewer, and those that are operational UN agencies. Number two would be to have a mechanism to limit the number of international NGOs according to competency, accreditation in countries. That leads us to the World Health Organization, and it's had many problems over the last few decades. The WHO was made to be more of a normative agency, and the way the infrastructure, and it's a very complex Byzantine infrastructure, they really work with the ministries of health. They're often embedded in the ministries of health. So when you have conflicts, particularly conflicts, I think it's easier, but not always, it's easier with natural disasters and epidemics. But even still, Ebola was not declared as quickly because the national governments didn't want anyone to know anything. And this is not unusual. You can't have an agency working with the Ministry of Health or a government that does not have the independence to declare a public health emergency, especially a global public health emergency. So there have been numerous, since my 14 years at UNHCR, there have been numerous attempts for WHO to reform. There's now currently another major attempt. They've got some really, really good people there to try to reform. I'm not convinced that it's going to work, not because of these people, but because of the complexity, including the member states. I mean, even as the reform was going on, you have regions within WHO, as you know. PAHO, the Pan American Health Organization, is actually part of WHO, and they're dealing with the Americas. You've got a strong Asian component. They don't want centralization. And so a lot of the time there's watering down of these reforms, even though the ideas start strong. So I'm not particularly hopeful, but if it doesn't reform this time, I think it's time we have either another agency, or you pluck out a certain part of WHO, those that have the competencies, and you bring in from other agencies, but you have a specific agency that is independent, that has it probably would have to be attached to WHO, but really has the independence to actually respond, and that really is operational. That would cause a lot of problems, and I don't think, as of yet, there's the political will. But if the reform this time doesn't work, let's see. I think there may be enough of a frustration from some of the big powers to say it's time to do something a bit more radical. But what we've seen consistently is reforms start and everyone thinks it's going to be a big reform, radical reform, but then due to political pressures and power politics, it always gets watered down. Last two, and then I'll open up for questions. This one actually may be really interesting and a lot of fun, is to make interventions more effective. Let me just get to this. So one of the big problems in humanitarian is that humanitarian funding is yearly. So yet, as we know, there are prolonged situations, and it's never enough, and therefore number one is there's not enough prioritization, as I mentioned before, and so what often happens is, as opposed to actually saying we're going to start on the life-saving interventions, what happens is there's just okay, we'll give a sprinkle here, a sprinkle there, so we'll do a bit of education, sexual gender-based violence, certain amount of health, but not enough, and there's really no way to make these decisions in a evidence-based manner, and also there's really no way there's no one sufficiently empowered to say this is the way we're going to do it. So there's always a lot of horse trading. Excuse me. So there is a need to improve the efficiency and the effectiveness. But what could be very interesting is donors are now talking about multi-year funding. They haven't talked about this for a while. So because the other problem is it's 1 year funding, certain things like livelihoods, to develop refugee skills to be able to then become more independent or sustainable, takes a long period of time, many, many years. When you have funding cuts, it's those things that are cut almost immediately. So it makes it very, very difficult to actually, for some of the longer term programs, to plan. They'll always be cut, to be cut. So if donors can move towards multi-year funding, excuse me, and then we can put certain amount of money, firewall a certain amount of money for really important issues that are a bit longer term. The other issue that I wanted to mention were cash transfers. So cash transfers, in the past we did mostly in kind. U.S. gave a huge amount of surplus food, as you're all aware, to the World Food Program, shipped it across the world with American shipping companies, and it was delivered. And it was not an effective way to, except in certain situations when there is not sufficient local food. We would buy blankets and jerry cans from wherever and ship them in. It was an inefficient way of doing things. cash-based transfers have been going on. It's not new, but it was been primarily in the food and food security sectors, and it really started a lot with vouchers. So trying to give vouchers where refugees or IDPs or whomever, just nationals, could actually go get certain foods. But in the Syria situation, because there are functioning, particularly on the outside, Jordan, within Syria now, it's very difficult, but within Jordan and Lebanon and Egypt, functioning systems. It's happening now in Kenya and even Somalia, where there's strong banking systems, and in Somalia you've got very, very good cellular networks, and so money is moving by phone, M-Pesa and others. So this idea of giving cash and allowing the refugee or the IDP or the national to make a decision, not just in terms of food, but they can spend it on whichever sector they would like, is really exciting, but it's also upending a lot of ways. How do we decide who gets that? In the past, who was vulnerable was very much sector specific. You would see what were the needs for shelter, what were the needs for food, what were the needs for health, and each sector would do it individually. Now we're moving more towards socioeconomic models. It's complex. Things can change. For cash for health and education, which are not just market commodities, but you need to look at the supply and the demand. You can give all the money you want. Obviously, if there's no food, that won't work, and so you need to do a proper market assessment. But generally, the markets will adjust. But it's not going to be happening so easy in healthcare if you don't have the buildings, or you don't have the infrastructure, and you don't have the qualified healthcare personnel. So same with education. So there's a lot that we need to do to actually start doing more research to see what is needed. But how cash will change the way the UN and the international NGOs respond, it's going to be a big shakeup, because as we're working with DFID and OCHA, ECHO and other big donors, they're saying, why do I need to give different amounts of cash to different UN and international NGOs? Why can't we just give it to one? And they're starting to do that actually in Turkey. So again, it's upending the business models that everyone has been working on for many years. And the last is that I want to discuss is really data and research. Most of what, maybe that's too harsh, but much, if not most, of what we do is really not based on sufficient data. A lot of it is based on experience and on consensus. So many of you are aware of the SPHERE guidelines, mostly camp-based in a way, but there is not sufficient data to be able to show why do we need 15 liters per person per day of water. The death rates of 1 death per 10,000 per day are based on a doubling of the baseline of sub-Saharan Africa, but they're not sufficiently context and nuanced. So much more needs to be done, and one of the areas that I hope that we will work on at Hopkins, but I hope everyone will work on, is the cost effectiveness of what we do. And the reason I'm hoping we work on that is because for the Syria situation, we had to make a tremendous amount of life and death decisions without sufficient data on. We would have huge fluctuations of money that was coming to us. So we had to decide which interventions to do and which not to do. We tried to set out broad guidelines, as I mentioned, primary health care, then emergency care, particularly emergency obstetrical care. But you had neonatal care where you'd be going in and you'd be spending tens, even at one point we had over $100,000 for one situation, which is not, you just can't do that. But it's hard to make those decisions. The other area that I hope for cost effectiveness that we can look at is this idea of infrastructure, and it does relate to development. But in Zatri camp, the type of water infrastructure, water and sanitation infrastructure that was put in was very, very poor. It was meant for a year, and it was deliberately meant for that because, number one, there wasn't enough money. A lot of infrastructure, you need a significant upfront investment. But if we can prove over time, 5 years, 10 years, with upkeep, you're going to save so much more money than if you did the upfront investment. We don't have that data, but we're starting to. But then number two, again, politics, you have to convince a government, the host government, to allow that when they're saying, but I only want these refugees here for a year. It's not going to happen. And you just hear this all the time. Yet, of course, that's not the case. That's not reality. But there are the political realities that everyone has to deal with. And the last, I'll end just by saying the last aspect that could be actually two aspects. One is there is really a limited amount of funding for research in humanitarian settings. There is something called R2HC, which is a fund developed by Wellcome Trust and DFID, but that's one of the few decent funding mechanisms solely for humanitarian. Otherwise, most donors say, I think incorrectly, but there just isn't enough money to begin with. We need our money to immediately save lives, which we understand. But if you can step back and have a certain amount of funding to do research so that in the end we can probably save more lives in a more effective manner, which is less costly, that will pay off. But that's more difficult. So we'll see how that goes. I don't think at this point I'm aware of any big donors walling off a certain amount of money for the humanitarian research. And then the other big problem we have are, particularly in acute emergencies, is dealing with ethical approvals. So we always see, we saw this in Ebola, but we often see it in cholera and other areas, is that if you don't get ethical approval ahead of time, both, and in the past, this is, when there were not as strong governments, you only got ethical approval in the past from Hopkins, from the institution. Now, which was wrong. Now you need ethical approval from wherever you're working, but you need ethical approval at the local level. But it needs to be done ahead of time, yet that's extremely difficult to do. Similarly, are a lot of problems with open data sharing and protocols. So there's a lot that probably could be done ahead of time if there was a will and a way. And Ebola maybe helped to shed light on that, and there is talk about this, but it's been something that we've known for a long time. And just like, as you know, just like humanitarian response, it's not so idealistic. There's a lot of fighting. There's a lot of competition. It's the same in the academic world, as we all know. And so in Ebola, there were different groups doing different modeling scenarios, but not sharing any of this data. In fact, not even admitting they were going to do it. They were doing it until they could come out with it. And so we need to be able to try to address this, but it requires, just like, again, it just requires people to be able to take away their need for publishing and for the prestige to be able to actually work more closely together. Then let's see if that will happen. I'm ending now just by showing some of the other forgotten emergencies, because Syria is hugely important, as we all know, but there's a limited amount of funding, and also there's a tremendous amount of funding that is earmarked to Syria's situation. And because the funding hasn't kept up with the need, it means that there's a reduction of funding in most of these forgotten areas. And so you should see some of these long-term refugee camps that we've been working in for decades. The amount of funding for them for those situations are significantly reduced, and the people are suffering big time. So again, Central African Republic, there was again just a massacre recently. It's brewing. There's so much unease in this area. I don't think I put Burundi, but Burundi is horrific. What's happening now? The Rohingya in Myanmar. Darfur, there's still a tremendous amount of refugees, and I should have just added IDPs within Darfur and Chad. A tremendous amount. It's still going on, but again, no money, and in fact, the Sudanese government doesn't even allow access in those areas. So I want to end there just by showing this picture again to show everyone the shame that we should all feel about Syria and what's happening there. Thank you very much. I think we're open for some questions, and yeah, we can point them out, and then there are microphones so that those that are listening. So if you want to, please go.
Get to a microphone just so we can all
Yeah.
answer this for
And we'll start with you. And please just say who you are and what you're studying.
Hi, I'm Carolina. I'm from the MPH program. I'm in the Health and Crisis and Humanitarian Assistance concentration. I'm interested, you mentioned about the need for increased research. What in particular research do you think would be best to prioritize, and what interventions would that translate to the quickest?
Those would be my interests. Tough one. These are difficult because they're difficult because one needs to be able to look at, I think at least, what is going to have the biggest effect. But just like, Court and I were talking, and he's looking a lot at trafficking situations in these areas. It's a hugely important area. And there are many other sexual gender-based violence issues. So how to actually decide, one would have to have criteria. The Global Health Cluster has tried, this is a group that works in the humanitarian world that WHO leads, and they've come up with a list of what they think are important. But what we've seen consistently, though, is donors have their own priorities, and so it has to be weighed up a little bit. You look at protection, you look at other areas, and in my view, it still should be those areas that will save the most amount of lives, frankly. That's still what I think needs to be examined. But it can be looked at in different ways in terms of, it could be lives. In many situations, I didn't say this, but in Jordan and Lebanon, the mortality rates among the refugees are not that high, actually. They're similar to the local populations. It's the quality of life, it's the morbidity aspects that are really are horrific. And then I'll just end by saying, others will say you need to think not just of the immediate, but you need to think of the long term. So often what happens is education is pushed aside, and there's insufficient, not just research, but response, because you need to do you need to respond on the life-saving, but then you're going to have these children with no education and very little future for generations afterwards. So the answer, I think, is it's extremely difficult, and everyone will have a different way of looking at it, but there could be more consensus, at least amongst the researchers. Please.
Hi, Dr. Spiegel. Thank you so much for your talk. I had a quick question about the political troubles that you mentioned in your talk. Especially with regards to the UN, we often see various videos online about, refugees coming and speaking to the UN about the plight of their country, and especially with Russia's recent involvement in airstrikes, and it's just making things even more difficult with more and more countries coming in to the picture. So I'm wondering, how much influence does the UN actually have on getting governments, for example, like Russia, to get out of that conflict and to prevent causing more casualties? And because right now it seems like the UN is doing more disaster relief response, but it doesn't have as much political influence. I'm interested to see if you agree with that or have any other insights.
Yeah, no, it's a difficult question, but the UN is, and this is a bit of a cop-out answer, but the UN is it's member states, right? It's made of member states, and the Security Council right now you can have the General Assembly, but really the power and the decision-making is the UN Security Council, which is a relic of post-World War II. So those that are there, in particular Europe, having 3 seats, am I right? Yeah, makes no sense. So one of the problems right now, I would say, is that you see Ban Ki-moon, and he may not be the most eloquent of spokespeople for the UN, but he can make certain statements, but frankly they'll fall on dead ears. And right now it's so clear Russia and the US are at odds with each other. I don't think the UN can do very much, and because of the rules and because of particularly the Security Council and the veto. The only thing that the Secretary General can do, and that the rest of the UN can do, is try to show evidence and try to name and shame. But the hard lesson learned is that governments in the end will always do, and maybe this is what they should be doing if you're less idealistic, what is in their best interests. So I'm quite pessimistic, and particularly now because you've got Russia and the U.S., but you've also got regional strong powers like the Saudis and Iran. You've got a big Shia-Sunni split, and so it's not just happening at the global level; it's happening at a regional level. So I mean, it's sad, but I'm quite pessimistic, I don't have a huge amount of hope for both in terms of Yemen, in terms of Syria, for the moment. But again, it's easy to blame the UN, but really the root cause are the key governments that are dealing with this. Please.
Hi. Emily Lyles. I'm a health systems PhD student. I wonder if you can speak, kind of building off both of those questions, but speak about coordinating with governments locally, not only for implementing, but for research. Having just met last week in Lebanon with the head of health for UNHCR, it kept coming down to, like, we need numbers, we need data so we can actually inform, but the ministry won't allow it. Or if we have the numbers, the ministry will fight them. So what are your thoughts on moving forward, how to kind of improve those relationships and work to enhance the ability to actually get the information we need to be making decisions?
Yeah. No, I'm certainly familiar with the Lebanon situation. Indirectly, I'll answer, and then I'll answer directly. Indirectly is we can work easier, and the world can respond to refugees because they're outside of a country. Why is the response so poor to IDPs? Because it's an autonomy issue. You know, Russia doesn't want the UN in Chechnya, and China doesn't want in Tibet, and probably the US doesn't want along the Mexican border. So, but ultimately it has to do with autonomy, and Lebanon it's ultimately the government, the host governments that will make these decisions, and Lebanon is so politically fragile right now. So one of the problems, and I know Shannon has done a lot of research in these areas, and yourself, is that the implications of this research can have some negative effects politically for these governments. And so I think we can talk, we can keep on talking and asking, but the governments will do what's most important for them. And so we can try to, again, it's really more diplomacy and convincing, but we are also, and it's a negative aspect, but we're also saying, well, we'll move towards those governments that actually will allow. For example, again, this idea with the World Bank, they are finding interesting findings that, in fact, the refugees may help the national economies. If we can get more and more governments to look at that, to see that that's the case, maybe they will allow more research. Similarly, we do a lot of research in Uganda on out of camp, because Uganda is one of those countries that has allowed it. And if we can get the research out there, maybe that will convince other governments that, okay, this works and there isn't a political backlash. But it's very difficult because the UN doesn't have and shouldn't have the authority to say to a national government, we're going to do, or the NGOs, we're going to do X, Y, and Z. So it's really a matter of persuasion than anything else. Not a necessarily a satisfactory answer, but it's the way it is. Sure. Yep. We'll do maybe one. No, we can do one more. We can do you as well. That's fine. Go ahead, please.
Hi, I'm Brendan Fries. I'm a master's student in epidemiology. My question was about talking about the phenomenon of targeting healthcare facilities and healthcare workers in the recent conflicts, and as well as individually, I've noticed using them as political tools against whatever governments they come from seems to be a common phenomenon now too. As far as improving protection, I know the UN peacekeeping forces often lack like the will or ability to even enforce peacekeeping mandates, or and paying local security forces could basically create bias or essentially fund warlords. What measures could be implemented to improve that security in places like Syria or Yemen?
Yeah. This is why this center needs to expand to SICE. Because a lot of these, and I understand, but a lot of these questions, rightly so, are very political in nature, but they're important. UN peacekeepers, my goodness, so many of the peacekeepers, the peacekeeping countries send troops because they can get a fair bit of money. And so you don't have a lot of the troops that go, they actually, it's not due to necessarily their competence, it's due to actually the need, either both in terms of prestige, but also the amount of money that some of these troops can get. So that's why you find a lot of quite poor countries sending troops. Number one. Number two is the Security Council has to be able to allow, to pass what sort of, is it going to be peacekeeping, is it going to be active? There are these different ways of response, and most of the time, for instance, just recently South Sudan refused until the last moment, and now the UN is going to be sending a certain amount, but a very limited number of peacekeeping because of the autonomy issue. So again, and I guess in the last 15 years, one of the things working with the UN is that really a lot can be done, but it's incremental, and it's a lot of it's going to be through diplomacy and patience. It's not going to be through the UN. It won't be something major. It's going to be, likely will not be. It's when Bill Clinton decided to go into to stop, in the Balkan War. It's when a country will be able to do that. The French have done this numerous times, stopping coups in Central Africa and some other areas. But the peacekeeping the other thing is it's incredibly expensive, peacekeeping, to do, and all of the money is coming from member states. So again, an unsatisfactory answer to say that it's not an easy situation. There needs to be improvements in terms of the quality of the peacekeeping troops that are there, but also the levels of engagement, and that requires generally an agreement from an autonomous government that would not like that to occur. Good. You want to close it? Yeah, go.
I think in the interest of time, because you all have classes, I want to say thank you for coming, those of you on the web for watching, and to Paul Spiegel for remarks that I think and hope are not just provoking of thought, but of action. As members of this school, as members of the community of public health researchers and practitioners, as citizens of your own country, and as citizens of the world, we cannot allow this to continue. Thank you very much, Dr. Spiegel.